The adoption barriers in healthcare AI, they don't appear in vendor decks. I wonder why. And they appear, though, in month 4 when the clinical team has been live for 90 days and adoption is abysmal at 22% max. And this is really a trust problem. Clinicians do not trust a black box. An algorithm that produces a risk score without explaining its reasoning will be overridden by experienced clinicians who can't reconcile it with their clinical judgment. The tools that achieve adoption are the ones that show their work. So here's the patient data the model used. Here's why this patient was flagged. Here's what the evidence says about this risk factor. Explainability is not a nice to have. It's an adoption prerequisite for clinicians. The workflow position problem here, where an AI recommendation appears in the clinical workflow, determines whether it gets acted on or not. A deterioration alert that fires in a nursing station dashboard that a nurse checks twice a shift, it's going to produce very different outcomes than the same alert integrated into the EHR workflow the nurse uses 40 billion times a day. Workflow position is a clinical design decision, and most AI tools don't come with it solved. The champion dependency problem is also important. Every AI deployment that succeeds has a physician champion, a nurse champion, a clinician with credibility who advocates for the tool, troubleshoots adoption issues with peers, and personalizes the case for use. When that person leaves or gets promoted, adoption often collapses. Success that depends on a single champion can be fragile. Health systems at scale, AI deployments build champion infrastructure, not just champions. Then there's the data quality problem nobody really admits to. The model performs to the quality of the data it ingests. So if your EHR data has documentation inconsistencies, missing fields, or coding variations by department, the model is going to perform inconsistently too. And we all know all of those data issues exist everywhere. Most health systems discover their data quality problems for the first time when an AI deployment surfaces them. This is not the vendor's fault. It's also not a surprise if you audit your data before you sign the contract. Data governance comes first, then AI governance.